All right, y'all, in this video, we're gonna be going over forearm soft tissue manipulation and wrist and elbow mobilization. What you're gonna need is a raised surface. I've got my massage table here. If you don't have a massage table, I would recommend coffee table, kitchen counter, plyo box if you're at a gym, anything that's gonna be raised off. And I wouldn't actually recommend a massage table because of the cushion. We want something with a hard surface because we're gonna be using our tools to kind of dig into the soft tissue. If you have some sort of pathology or deep tenderness and sensitivity within the forearm muscles, maybe a massage table would be good because that extra cushion allows you to manipulate the tissue in a safer way, if you will. As far as tools, I have a trigger point ball by Trigger Point. A lacrosse ball will work. And this right here is not an official tool. It's just two lacrosse balls taped together. These massage tools that are kind of peanut shaped are universal, if you will. So if you have a peanut shaped tool, that will work as well. I highly recommend investing in two lacrosse balls, getting some medical tape and just creating one of these. It is a fantastic tool for forearm, tricep, soft tissue manipulation. All right. So before we get into the stretches, let's get into a little bit of anatomy. Super simple. What you have, so if we're in anatomical position, right? So top part of the forearm, these are the flexors. So fingers come into a fist, wrist comes towards the pit of the elbow. And when you do that, you can see, I don't know if you can see it here, but you can see the muscles contract. That's pretty much one half of what we will be working, right? And then on the other end are the extensors. So wrist comes back, fingers come out here, and you're gonna get the muscles popping right there all the way through. So as far as warming up the area, something super simple we can do is just, you can use your other hand or you can use your forearm and you're leaning in. And I'm not voluntarily having my fingers curl in. That's when you know you're doing it right, is when the fingers are just kind of curling in on their own, because as you do this, the soft tissue will shorten, right? So trying to just kind of say hello to the tissue, warm the area up, and then flipping on over to the other side, same thing. Take as long as you need, pause the video if you feel like you need to. You know, with the extensors, you can grab that mass of muscle there and just kind of press, release, use your forearm. And as you can see, I'm kind of pinning and leaning, right? You don't have to be an expert at this right out the gates. You're going to learn your body. You're going to figure it out as you go, right? And we're not looking for anything too crazy here. Looking for the pain points. Some of you that have tennis or golfer's elbow, you might find something flaring up right away. But for the most part, this is kind of just saying hello to the tissue, right? This feels really good for me. I just got done with a few sessions. So I'm again, this mass of extensor muscles, grabbing that mass with the palm of my hand and my fingers. And I'm grabbing, and then I'm kind of internally rotating my shoulder while leaning forward, and the oil from my skin is allowing it to just kind of go across fibers. So the fibers are going this way, the pressure is going cross fiber. It's like 112 degrees out in the heat index today, so you might have some natural lubricant for this work, which is great. Cool. So I'm gonna grab my trigger point ball, lacrosse ball, whatever it is that you have, tennis ball, whatever works for you. And again, so we're talking about flexors that come to the inside bony notch there, the humerus bone, if you will, the funny bone. And then on the other side, it's the notch on the outside of the elbow. We're gonna be focusing on the inside notch here. Really simple. All you gotta do is face that mass of tissue down towards the table, the surface, and you can either just roll around side to side, up and down. And once you find the tender area, you can take the middle of the opposite forearm and just lean in, right? So we're kind of just manipulating the tissue back and forth. We're not looking for a 10 out of 10 pain scale here. We're looking for whatever's tolerable, really. It's all subjective, right? So some cues are that if your body is tensing up, that's a sign that you're going too hard. If you lose control of your breath, that's a sign that you're going too hard. If you're wincing, it's a sign you're going too hard. We want to be right on the edge of where we can stay relaxed, keep the muscles relaxed, and be able to connect with our breath and feel that deep sensation. Some people call it the good hurt. I don't like that. Although I understand it is a good hurt, it's more of a deep sensation that we can sit with, knowing that it feels productive, if you will. So as you can see here, I'm just kind of going in and out, up and down, side to side, manipulating the tissue back and forth. I'm getting closer to that elbow bone. It's getting real sticky up there. You can come more towards the wrist. Put in some pressure by leaning in, keeping the shoulders relaxed, keeping the shoulders down, and then just kind of dragging over that ball to the elbow, which is good. Yep. And something I forgot to mention is I like having a surface and making sure that the wrist is able to go over the edge of the surface, because once the tissue is warmed up, once you're feeling really good in that area, you've been maybe manipulating the tissue for 2 minutes, however long, and you find a really good sticky spot, what you can do is find that spot that's screaming at you within reason. Again, don't injure yourself, don't exacerbate anything, but the most tender area, you can, again, shoulders down and back, posture up, lean in, and then if you feel safe doing so, I'm going to make a fist and then bring my fist towards my forearm. That's going to engage all those muscles. You're probably going to feel yourself pop up off the ball. Hold, 3, 2, 1, and then relax, let go, let go, let go. Lean in a little deeper and allow your tissues to melt around that massage tool. If you're getting any sort of nervy sensation, obviously come on out. That's not what we're looking for. If you're feeling radiating sensation, like right there, I felt a radiating sensation from elbow all the way through my pinky and ring finger. It wasn't nervy, it just felt like a line of tension. Generally speaking, that's a trigger point, that's a good thing, you're on a good spot. All right, so again, we're gonna find the most tender area. We're gonna posture up, put our forearm into like right on top of the ball, keeping that wrist relaxed, both wrists relaxed, and then we're gonna take a deep breath in. Hold at the top, flex the fist, flex the wrist towards the forearm. 3, 2, 1, exhale. Let it go, let it go, let it go. Lean on in and come on out. Good. You want to do a little more scrubbing here and there, go for it. As far as the peanut goes, I mean, it's whatever you want to use. If you don't have one, that's fine. If you do have one, it may be a little easier to track back and forth and really get in towards the tissue towards the wrist where it becomes less dense. It's not absolutely necessary. You can do great work with a single ball. All right, so as far as the other side goes, you're going to need to position yourself in a way to where your torso is essentially perpendicular with the surface. I don't know if you can see, but my left leg, so I'm working my right side, my left leg is up and I'm in a kneeling prisoner squat lunge position, and I'm externally rotating my shoulder and I'm laterally flexing towards the table, and that's how you're gonna get to those tissues, right? So before getting into that, if you want to take the ball and kind of scrub around here, that's a good way to kind of warm up the tissue. Oof, it's a great way to warm up the tissue if you just got done typing for 14 hours, you psychopaths working 14 hours at a desk, I know you exist. Rock climbing, massage therapy, whatever it is. If your forearms are tender, this is a great way to kind of scrub and warm the tissue up. And then once you feel like you're ready, again, posture up. I'm laterally flexing, rotating not from the elbow or the wrist, but from the shoulder. Looking for that spot. You can press down with the palm, forearm, whatever it is. And I'm kind of just leaning in. Real easy for me to find that most tender area. Oh. Right, so you can pin and just roll. So you may not be able to see it. Sorry if my hand was in the way. Pin, and I'm moving. For those who have received massage therapy from me, you know my style is deep tissue trigger point therapy with very, very slow articulated strokes. So a combination of trigger point therapy, myofascial release, deep tissue work combined into one. And I like to do the same thing when I'm doing self-administered release techniques, what we're doing right now. So I'm pinning, trying to keep my body relaxed, and micrometer by micrometer, I'm leaning back and allowing the tissue to scrub over the ball. And I can feel it in my thumb and my pointer finger. Good. Reposition. Looking for tender area, easy to find. Again, just got done working with a few clients, so a bit flared up right now. So you can pin and lean back, and the ball goes towards my wrist and my fingers, trying to keep that wrist relaxed. Or if it feels good, you can lean forward a little bit and kind of push the ball up against that bony landmark. You can go down to the left. I feel that in my bicep and delts. You can rotate a little more. Again, whatever feels good for you, whatever feels intuitive, go for it. For some reason, it was real easy for me to find that one spot, just right there. And then when you feel like you're warmed up and you want to go deeper, you can find that most tender area, pin, relax into it, and then open up the hand, really flex those muscles, extend, and relax. Extend the fingers, extend the wrist, and relax. Good. And finding the most tender area right there, relaxing the shoulders, posturing up, and leaning in. And then I'm gonna micrometer, lean on back. I'm kind of pushing through my left foot very subtly to shift my whole body back. And then I'm coming back in. I'm extending and relaxing. See, wincing there, so I went a little too hard. Deep breath in, exhale, and allowing the body to fall into the most tender area. Feeling it in my thumb. Ooh, man, that is a good spot. Playing with wrist positioning, rotating the wrist, flexing, extending, relaxing, and letting go. All right. Feel like you want to do more scrubbing, whatever it may be, go ahead and pause the video. It's a little more difficult the closer you get to the wrist to keep that shoulder externally rotated, keeping that pressure on. It might be best to just use your own elbow and forearm to press and lean if you're feeling a lot of tenderness or tightness in the fascia as you get closer to the wrist, whatever it is you want to do. All right, so that does it for the release portion of the forearm muscles and soft tissue. Go ahead and do the other side if you feel called to do so. I highly recommend it. But if you're only working on one arm because of a certain pathology, totally fine. And go ahead and move on over to the mobility portion. As far as how often you should be doing this, honestly, every single day that you have time to do so, just don't overdo it. It can be very easy to dig on in for 10 minutes in one area because it feels, hurts so good, if you will. This is a marathon, not a sprint. It took weeks, months, years for this pathology to flare up, but it's gonna take consistent practice, potentially, yes, weeks for it to go away. So be patient, be consistent, and it'll be gone before you know it. All right?